Okay, let's dive right into this. Welcome to This Explainer. Today, we're heading out on, honestly, what feels like an epic, real-world mission. We're going to explore the intersection of public health and the incredibly tricky world of ethics. We're looking at a fascinating case study that actually tests how our leaders make massive, life-altering decisions when literally every single second counts. But before we get too far in, I've got a huge question for you. Think about it. If you had to break a strict rule to save someone's life, would you do it? What if breaking that rule got you into major trouble, but following it meant someone might get hurt? That right there, that's the high-stakes moral dilemma we're going to try to solve together today.
Chapter 1. Meet the Virus Villain. You know, every great story needs a villain, and unfortunately for us, ours is very real. We're facing a slightly spooky, microscopic enemy, the Chandipura Virus, or CHPV for short. This virus recently caused a really serious outbreak in the Indian states of Gujarat and Rajasthan. And this villain, it's got a very specific, totally unfair target.
75%. Let that sink in. According to past data from the World Health Organization, this virus has a terrifying 56 to 75% mortality rate. To put that into perspective, that means it's deadly to more than half the people who catch it. So yeah, it's incredibly dangerous, and it sets up extreme urgency. When this thing shows up, public health heroes have to act at absolute lightning speed.
So here are the facts on how it operates. The virus spreads through these tiny insects called sandflies. Its primary targets? Kids under the age of 15. Once it attacks, it moves incredibly fast. We're talking about causing acute encephalitis syndrome, which is a severe, super dangerous brain fever in just 48 to 72 hours. And the absolute scariest part of all this? There's no specific cure and zero vaccine.
But hey, don't worry too much, because when a villain strikes, the government heroes deploy. In real life, the government instantly sent in their top rescue teams, the National Joint Outbreak Response Team, or NJORT, and the National Center for Disease Control. They rushed in, started drawing blood for serosurveys to track the virus, and launched these massive bug-spraying missions, what they call vector control, to basically wipe out those pesky sandflies. They were right there on the ground trying to save the day. Moving on to Chapter 2. The Hero's Ethics Toolkit. Because, well, to fight complex battles, our heroes don't just rely on microscopes in medicine. They use an ethics toolkit. These are the big philosophical rules our leaders use when dealing with transparency, compassion, and making those really tricky decisions when the right answer isn't so obvious. The first tool in our kit is the Precautionary Principle. It's actually pretty simple. Think of it like this. If you look outside and the sky is pitch black and cloudy, you grab an umbrella, right? You don't sit around waiting for the meteorologist to give you a 100% scientific guarantee that rain is falling. In public health, when there's no cure for a fast-moving virus, you take action to stop the danger immediately. Waiting around for absolute scientific proof? That might literally cost lives.
Next up, we have distributive justice. The Chandipura virus tends to hit rural, tribal, and low-income areas the hardest. Basically, places where hospitals might be super far away or just don't have enough supplies. Distributive justice means fairly sharing our resources so we help those vulnerable groups first. It's all about making sure everyone gets a fair, fighting chance to stay healthy no matter their zip code.
And that brings us to the right to health, which is a massive part of Article 21 of the Constitution. This rule guarantees that the fundamental right to life absolutely includes the right to be healthy. It means every single life matters immensely, and it demands that administrators act with real empathy and speed to protect everyone.
All right, Chapter 3, Dr. Rohan's Big Dilemma. Let's put our brand new toolkit to the test. We're going to introduce a fictional hero for our case study, District Health Officer Dr. Rohan Mehta. Dr. Rohan is facing a massive puzzle in his district right now. Kids are coming in with this unknown fever, and they are getting very sick very fast.
But before Dr. Rohan can make his move, we need to look at all the players on the board. You've got Dr. Rohan himself. You've got the sick kids and their families whose right to life is obviously the top priority. Then there's the general public, who definitely have a right to know what's going on. And on the flip side, we have politicians and the state headquarters. They're terrified that declaring an emergency right in the middle of election season might cause a huge panic or make it look like they're failing at their administrative jobs. It's a mess. Everyone wants something different.
Now, what's really interesting here is the agonizing conflict Dr. Rohan is facing. He has these raw, immediate facts in front of him. 4 local kids have tragically died this week from this mystery fever. But the state headquarters has handed down a strict order. They said, do not issue a public alert. Wait 5 to 7 days for the official lab test to confirm exactly what the virus is. So Dr. Rohan is completely caught between saving lives today and following orders from his bosses.
Chapter 4. Weighing the 3 paths. So, what do? I want you to pretend you are Dr. Rohan right now. You're sitting in your office, staring at the data. You have 3 possible paths you can take. Let's pull out our philosopher toolkit and evaluate each choice. Path 1 is basically following headquarters orders and just waiting. But listen to this quote from philosopher J.S. Mill. "The greatest good for the greatest number." This is the core of a big philosophical idea called utilitarianism. Mill would say that just waiting around violates this rule completely. Letting more kids get sick while you twiddle your thumbs waiting for paperwork, that definitely does not do the greatest good. Okay, path 2 is the exact opposite. You ignore headquarters entirely, call the local news channels, and declare a massive emergency. But the philosopher Aristotle would actually warn against this. He believed in the golden mean, finding that perfect, safe balance between 2 extremes. Aristotle would look at path 2 and call it rashness. Spreading unconfirmed panic on the news without solid lab proof, that's an ethical risk that could cause some really dangerous chaos in the hospitals. Chapter 5. Making the right choice. If path 1 is way too slow and path 2 is way too chaotic, we need another option. The absolute winning move here is path 3. Dr. Rohan sends all his written data up to headquarters, attaching a strict deadline warning them of the danger. But simultaneously, he quietly and quickly starts local prevention measures, like spraying for sandflies, without setting off a massive public panic. Mahatma Gandhi would actually love path 3, thanks to his rule called the purity of means. He believed that how you do something, your methods, must be just as pure as your final goal. Staying totally silent just to keep political peace during an election season? That's wrong if it costs kids their lives. Dr. Rohan acts purely here by achieving his goal of starting prevention while still respecting his organization. And that brings us to Immanuel Kant's big concept, the categorical imperative. So the crucial point is his rule. Treat people as the goal, not as a tool. Kant is basically saying that human lives, especially the lives of these kids, are the ultimate goal. They can never just be used as pawns for administrative convenience. Path 3 respects those lives above everything else. Chapter 6. Protecting our future. Because let's be honest, we can't just rely on individual heroes to break the rules every single time. We need to build better institutional shields for the future. That way, when the next villain like the Chandipura Virus strikes, our local doctors don't have to face this terrible dilemma all by themselves. Here is our 4-step master plan to fix this. Step 1. Create SOPs, standard operating procedures, so doctors have an exact rule book on how to act before lab tests even come back. Step 2. Give local districts the autonomy to act quickly to save lives on their own. Step 3. Use risk communication to share facts honestly without causing a panic. And Step 4. Set up independent health committees. That keeps the politicians' election fears completely out of our medical emergencies. And that brings us to the end of our journey today, but the start of yours. Here's a quick homeworks challenge for you. In 150 words, how would you balance following the rules of your bosses with the urgent moral need to save a life? Pick one of our philosophers, Gandhi, Kant, or Aristotle, to back up your choice. Thanks so much for joining me on this explainer. Keep questioning, keep learning, and I'll catch you next time.